Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Pediatricians are concerned about the growing number of parents in the United States who are opting not to have their newborn babies receive a vitamin K shot. We'll learn more about the importance of injecting newborns with vitamin K from my guest, Dr. Steven Blatt. He's a professor of pediatrics and director of the General Pediatrics Division at Upstate. Welcome back to The Informed Patient, Dr. Blatt.
Thank you. Great to be with you.
I've read news articles about babies who went without the shot of vitamin K, who developed abdominal bleeding or bleeding in the brain, who died or were left brain damaged. Can you tell us how vitamin K prevents this?
Sure. So the body has a number of different systems to help us when we get injured and we're bleeding. We have platelets that help us stop the bleed, and we also have different coagulation factors. And it's a very complex system, the coagulation factors. And there are a number of different factors, and there are 4 different factors that actually require vitamin K to work properly. So if we're missing vitamin K, or if we have a vitamin K deficiency, those coagulation factors won't work and we will not be able to stop bleeding.
Does our body make vitamin K typically?
No, vitamin K we get from our diet, and a lot of it comes from green leafy vegetables. And some vitamin K actually comes from some animal products, but mostly it's from leafy vegetables. And obviously, newborns are not eating leafy vegetables. So newborns are born vitamin K deficient. And vitamin K is not really excreted in breast milk. So a baby who's breastfeeding will not get enough vitamin K, and you don't get enough vitamin K in formula either. So newborns are born vitamin K deficient, and that's why they need an outside source of vitamin K.
When were the vitamin K shots developed for use with newborns?
Vitamin K was first discovered in 1929, and it wasn't until 1961 that it really became a recommendation. So people knew about it before 1961, but in 1961, that's when the recommendation was to use vitamin K injections for newborns. So it's been around for over 60 years as a routine.
And it's an injection. How is it administered in hospitals in the US today, typically?
So, in every hospital in the country, there are always kind of standard orders for different types of patients, and newborns are no different. And so, one of the standard orders for newborns is that shortly after birth, and I mean 5-10 minutes, they typically get a shot, an injection of vitamin K. And one injection is all they need to take care of them going forward. People have looked at using an oral preparation of vitamin K, but the results are nowhere near as good as the injection. So the injection is what we use for newborns.
These standing orders, do parents have to give permission for the shot, or will the baby get the shot unless the parent raises an objection?
I think the way it is in most hospitals, and certainly as far as I know, all of the hospitals in central New York, the nurse, because these are typically nursing orders, will say to the parents, your doctor ordered vitamin K, could we go ahead and give it? And there are times where, along with some of the other standing orders, parents will say, well, I have a question about it or I don't want it. And then they have the opportunity to talk with their doctor. Never, as far as I know, in hospitals these days are things done to a baby without parental permission. So parents always have an opportunity to ask questions and to say no about anything, including vitamin K.
And this is just a one-time shot in the moments after birth, right?
Correct. It's a one-time shot, and that's all they need to keep them healthy.
Now, is there any legitimate medical reason that a baby would be recommended not to get a vitamin K shot?
People have looked at possible side effects to the injection to the vitamin K. And from time to time, people have raised theoretical concerns. Is the preservative a problem? Many years ago, there was a concern it could lead to another illness. But when it's been looked at, this has never been shown to be a real correlation or a real cause and effect. So we do not know of any negative outcome of giving vitamin K.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Upstate Professor of Pediatrics, Dr. Steven Blatt, about vitamin K. The Journal of the American Medical Association reported that the number of newborns missing vitamin K shots rose by about 77% from 2017 to 2024. So I'd like to ask you about the concerns that some parents have. Is there any connection between vitamin K injections and childhood leukemia?
Those were one of the illnesses that people looked at, and there is absolutely no connection that's been scientifically shown to exist between vitamin K injection and childhood leukemia.
And you mentioned the additives, I guess benzyl alcohol or polysorbate 80. Those have not been found to cause any harm to babies?
Correct. None of the additives has been found to cause harm or any side effects in babies.
Do you hear from parents who don't want their baby to feel the pain of a needle puncture in their first hours? Is that part of the objection?
When I talk to parents, I know when they object to vitamin K or sometimes they object to hepatitis B, that they have reservations about those interventions. And most of the time, I say, well, tell me what you're concerned about. And most of the time, they don't clearly tell me what their concern is. It's more a vague concern. So I've never had anybody tell me they're concerned about leukemia. And they typically don't say they're worried about the pain, but they say they don't feel comfortable with it. They want to think about it. They're not sure. And I don't press them too much. People, especially parents, especially newborn parents, they're going to feel what they feel, and I respect that. And they don't have to prove to me why they don't want something, and it's not a debate. I just want to understand what their concern is so I could help them. I think sometimes they don't even know for themselves. They may say, I'm just uncomfortable with it, or I'm worried about it, or they don't want to share it. So I respect that and move on. When I look at the literature, people do identify pain from an injection as one of the reasons they don't want it. But honestly, they don't typically tell me that. But I know that's what many of them are concerned about.
Have you cared for a newborn with spontaneous bleeding because of a lack of a vitamin K shot?
No, fortunately, I have not. But to be honest, I think it's a matter of time. Babies that do not get vitamin K are at significant increase for different types of bleeding problems. Some of them are minor, but the concern is they could be catastrophic. It could lead to major bleeds in the brain. It could lead to permanent and severe brain injury, and it could lead to death. Fortunately, we have not seen that here, but it's only a matter of time, given the fact that more and more people are refusing vitamin K.
Is there any way to predict which infants will be at risk for the worst outcomes if they don't get the shot?
Unfortunately, the really bad outcomes, we typically do not know they're happening until it's too late or almost too late. And that is because babies in general, and this could happen for older people too, but specifically in babies, they won't show any signs or symptoms that there's something bad going on until it's really at the end of the process and it's too late. For example, some babies could have an abdominal bleed and could bleed out a lot of blood into their abdomen, into their belly. And the only time you know they're having it is when they have a cardiac arrest. Similarly, they could have a head bleed and bleed into their brain, and the only sign that you know that they're having it is when they have a seizure or they stop breathing. There are no signs that this is going to happen until it's too late.
So there's nothing for parents to really keep an eye out for. The things you described are pretty severe with seizures. I mean, parents would notice that and maybe call the ambulance or get to the emergency room. But even if they do that, what can doctors do? It seems like it's at a pretty late stage by the time a brain bleed or an abdominal bleed has happened.
Yeah, absolutely. And that's one of the real scary things about this. I think, if people thought about it, they'd say, well, I would notice that my child is bruising or they have a little cut and they don't stop bleeding. That's not what's going to happen. One is not going to know that it's a problem until it's too late. And the other thing is that babies remain at risk going 6 months out of life. And it's not like if you get to the first week, then you don't have to worry anymore. This is for 6 months. And just think of all of the things that could happen to a baby. Just minor amounts of trauma could set off a catastrophic event. I don't even have any words for it. It's just a terrible thing waiting to happen.
What is the magic of the 6-month mark? Because babies aren't eating leafy greens at 6 months either. So what happens in their body that starts able to protect them by then?
Well, I think eventually they do get vitamin K from some different sources. They could get some from some of the bacteria in their intestine, and then they start eating different things. And eventually they'll get vitamin K. Prior to us having vitamin K, people eventually got it. I can't tell you more specific than that, but eventually they do get vitamin K and the clotting starts working. But until then, it's really hit or miss. There is some in breast milk, but it's very low levels and you cannot count on that. So eventually they get enough vitamin K in the body, but it takes 6 months.
So what are pediatricians doing to try to convince parents that this is important? I know that you meet one-on-one with parents, but in general, is there a campaign to make people aware of the importance of vitamin K?
There are a lot of things that are constantly bombarding people, especially newborn parents. And it's vitamin K, it's car seats, it's safe sleep, it's proper nutrition, it's immunizations, and they're all important. And it's hard to know up front what parent is going to listen to what information and reject other information. So we try to give all of this information as often as we can. The problem is a lot of the parents' minds are made up before we even meet them in the hospital. I mean, we have parents where they're on their fourth child, and the first three got all the shots, they got all the immunizations, the vitamin K, they did everything we recommended. And then by the time they have the next child, they've changed their mind and they said, no, I don't want it. So it's hard to know what information to give to what parent. For the individual pediatrician, it's hard. For the obstetrician, when I don't blame them because they're focusing on all the things on the mother's health that the mother needs to do for a healthy pregnancy. And even though they mention, by the way, you need to get immunizations and listen to what the pediatrician has to recommend, they are also working to get their message out. Then when you look at mass media, social media, it depends where parents go to get their information. So if they go to a reputable medical information site and they look, they will find that information. But a lot of people choose not to go to those sites. They go to other sites which won't even mention it or will say, don't get it because it's going to be harmful, which I believe is irresponsible and erroneous.
Well, thank you for making time to talk about this. I appreciate it.
Well, I appreciate you bringing this very important subject to your listeners. And as always, I'd like to remind your listeners that if you have a medical question, a podcast like this is a great way to get information to learn about things. But talk to your healthcare professional, talk to your obstetrician, your pediatrician, your family practitioner. Get good information so you as a parent can make good informed decisions for your children.
My guest has been Dr. Steven Blatt, Professor of Pediatrics and Director of the General Pediatrics Division at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes and transcripts at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.